Good morning. This morning I'd like to talk to you about live blood analysis. This is a service that's been in our office since the early 1970s. A nutritional company originally used to come and have a technician that came and did this service for us. In the last few years we've been without a technician, and we're happy to announce that we have a technician again. And she's fabulous, and her name is Tayon, and she's available in our office for appointments to have your live blood done. Live blood can tell a lot about how healthy you are, and it's used as a preventative method to tell you what's going on in your blood so that you can take an action now so that you don't have, so that you're always moving towards health instead of trying to get to a chronic space and then having her hurry up and try and fix it. So there's a few things that it can detect and help you to be more aware of, and one of it is acid alkaline levels, whether you're too acid or too alkaline, and really we want to be in the middle. And today's diet typically has us eating more acidic foods than more alkaline. In the early 1900s it was exactly the opposite. It was more alkaline foods. It helps us to find out about protein digestion, whether you're digesting your foods properly, and the imbalances that could happen in the small intestine, in the liver, and the gallbladder. It helps us to deal with kidney function, liver and bowel stress, to see what's going on there. It also can detect malabsorption. So if you're eating but you're not getting enough nourishment for the cells to reproduce and make healthy cells as you go along. It can find out if you've got bacteria, parasites, fungus, yeasts, any of those things in your blood, that there's really good and easy answers to help to clean that up. It can also find out if your immune system is compromised, and that is really an important factor. I remember years ago looking at live blood and finding a young person that their white blood cells were basically eating the red blood cells. And it was a very serious thing to see on the live blood, and I referred them immediately to the hospital, and they found out that she had a form of cancer. So it was, you know, it's a really good tool. We knew that she was sick. The parents knew that she was sick. They really didn't know what was really going on. It can help to see what the toxins in our life are doing, the free radicals like chemicals, things that you inhale that you can find, you know, in our atmosphere, junk foods, allergens, all those kinds of things. What kind of effect that has and compromises on your system that it makes on a day-to-day basis. So what we're looking for and hoping to help you with is to get to a higher level of health. I usually talk to my clients about nutrition and say, you know, we start off at birth with almost perfect health, and you never want to get to what I call the 100th part where you go to death. You always want to be moving towards health, back to perfect health. When we get to about 70%, when the body and the blood actually starts to show you something really serious, that's when you really need to go to your medical doctor, and you need to know that they can help you because their expertise is in pathology and chronic care once it gets past a certain point. But before that point, you as the person has all kinds of little symptoms. And what this helps you to see is when you have your live blood done, is those symptoms are a reality. They're showing you something that's going on in your blood. And our job is to help you find the nutritional factors, the nutritional supplements, whether it's food or vitamins and minerals, to help support you to get you back to the best level of health that you can have. So come and make an appointment, see Tayon to have your blood done, and afterwards you'll spend some time with either myself or Dr. Thyrat, and we'll go over the results with you and be able to tell you what you need to do to support yourself to move to a better level of health. Health is what we're about. If you don't have a healthy body, you don't have anything. Have a good day.